I'm Dr. Kent Stauffer, and I'm a veterinary surgeon here at Noah's Animal Hospital. And I've been a veterinarian for 30 years. And I had a general practice in Nebraska for 12 years. And then I sold it and went back and did a one-year internship and a 3-year surgery residency. And then became a specialist and a veterinary surgeon since that time, since about 1998. A lot of this is a hunt to find a reason for the problem. And then when you find the reason for the problem, the next step is to help the patient out and correct it. So most of what we do is a diagnostic hunt. Just because they come lame on a rear limb doesn't always mean it's a cruciate tear. So you have to do your push-ups each and every time to not become cookie cutter in what you do. And that's part of the theory behind being a surgeon, is the workup involved in the case, knowing what the case involves, age, breed, weight, sex, what the presentation is, chronicity of the disease process, how much arthritic change is present, so you can give the owner an honest estimation as to what the outcome will be, which I think is very important. It's always funny in human medicine, if you're 55 like me and you're arthritic and you go to the doctor, they go, well, we got this and this, or you get a total knee replacement. Which would you like to do? Well, I really don't want a total knee replacement, okay? But there are shades of gray that at least they could sit and talk to you about. And owners expect a lot out of these little dogs from a recovery standpoint in a quick amount of time. For instance, if I tear my ACL, I'm 6 months to a year in rehab. And these owners want these dogs normal in a month. And so that's where it's important on the front end to be able to honestly tell them, here's what your expectations are for the surgery that we do, so that we don't promote false expectations, but yet give the owners honest opinions as to what we have. You have to have people skills, number one. You have to listen, number two. And you have to know when to talk and when not to talk. You need to let them tell the story. And you could take 3 different doctors and take 3 different histories on the same patient, and every doctor would probably take a different history. So that's tremendously important, because when they come to us, no matter what we read and what we see, you still have to do the sit down and you say, please tell me from the beginning how this came about, because the stories differ each time. And that isn't because the owners are telling it wrong. Maybe they are telling it differently, and nuances to that history are important. So that's the hard part about it is that people get to talk to you, the dogs don't. Then you look at the dog and see what they're doing. Then you look at the films. So never do I personally look at radiographs before I hear the story, feel the animal, see the animal. Then I'll look at radiographs, because there's a sequence to how we're looking at these, so you don't prejudice yourself against jumping to a conclusion or diagnosis, so to speak. I'm Dr. Kent Stauffer. I'm a board-certified veterinary surgeon at Noah's Animal Hospitals in Indianapolis, and I'm looking forward to meeting you and your pet. Please call anytime for an appointment. We look forward to seeing you.